Guest speaker today is a multi-talented young man whom you already know very well in the area of either journalism or reporting, but today you're going to get to know him a little more deeper, for he's also in the medical corps, and that is even his main profession. He is a pharmacist intern, soon to be a doctor in a couple of weeks. And dear viewers, I believe that if we pay attention, we are going to get a little bit of, everything, so which is going to be very useful to us. So he's going to be speaking to us in 30 minutes. For the first 25 minutes, he will do his presentation, and in the last 5 to 10 minutes, he will be receiving questions and reactions from the audience. So please, I call on all to stay focused, stay attentive. If you have any questions, jot them down, and I will give you time to react when the time has come. So our guest speaker of today is no other person than Mr. Ernest Kumba, soon to be a doctor. Please join me to welcome this elegant young man.
Yes, Gilette, thank you for that kind of wonderful introduction that sometimes I don't even seem to know that you have it.
On Sunday, February 25th, 2024, Gaza Media hosted another amazing health presentation, and the topic of discussion was stroke, presented by Mr. Ernest Kumba, pharmacist intern soon to be a doctor. First, he started by presenting the clinical situation of a patient.
A lady, Mrs. Stroke, who is an 81-year-old female, was taken to an urgent care by the son because she was having some kind of abnormal behavior. And the son explained to the emergency attending physician that the mother started having difficulty speaking clearly, and her face was dropping and was unable to raise her hand. So I think if Dr. Fozao is here, you may be able to understand, because this is the kind of stuff that he sees on a daily basis.
He then defines stroke in very simple terms as a condition where the brain is deprived of blood, while classifying stroke into two main types, which he said are acute ischemic and hemorrhage stroke.
There are two main types of stroke. You have what we call acute ischemic stroke, and we know what we also have as hemorrhage. That means bleeding in the brain.
And using a diagram, he illustrated the pathophysiology.
Let me use this cartoon to just illustrate what I was explaining. Okay, yeah, I have my mouse here. This is ischemic stroke. This area where you see, which is a little bit like kind of bluish, where our area deprived of blood. Around this area, for example, the cell will die. And if this cell are the cell that coordinate the movement of a particular region of the body, then that region of the body does no longer respond. If it's on the lower extremities, like down the legs, then you see that somebody who have a stroke may paralyze down there, will never respond, because once this cell die, they can never be replaced. So here you see what is known as a clot is here. It's like you have a sink in the kitchen, then you drain oil or fatty food or something into the drainage system, that clot it, then water can no longer go through. Contrast to hemorrhage stroke, where the vessel is teared off by some injury, then blood spilled out to this part of the brain. And this blood contain toxin, then those cells and kill these surrounding cells. And the person is no longer able to respond.
He then went further to present some risk factors, which he explained that modifiable risk factors are those factors that can be controlled.
I've separated them to modifiable risk factor and non-modifiable risk factor. You have hypertension, which I think Dr. Awu Supreme will talk on that on our subsequent presentation. If you have high blood pressure, which result to hypertension, then your risk of having stroke is very high. If you have atrial fibrillation, that means you have some kind of heart problem, a normal heartbeat, your rate is also high. If you have high cholesterol, dyslipidemia, you are also at high risk of having stroke. If you have diabetes, your risk is high. If you are physically inactive, like doing sport, moving around, especially like us in the Western where we drive a lot of cars, or we don't even walk around, we're already in car, your risk of having stroke also goes up. Smoking is part of it. So modifying weight, these are things that we can actually control. And this is where I would like us to talk more on these factors, that things that we can do ourselves to prevent stroke from happening.
Indeed, Ernest Kumba, a doctor to be, encourages the audience to modify their lifestyle, like drinking less alcohol, doing exercises, and follow the doctor's guide if you're already a stroke victim.
We talk about the risk factor. Watch your blood pressure. Watch your diabetes, sugar. Try to be active. Do a little bit of exercise. Monitor your blood cholesterol level. Don't smoke. If you are 80 and above, there's nothing you can do. You cannot change your age. You can only begin to watch what you eat and just do. God forbid, if you have sickle cell anemia, please make sure you don't get into fight where you can injure yourself and fall and stuff like that. If you already have a stroke, I believe the health professional, the doctor, they will begin to advise you on what to do. And when you see any person with signs and symptoms, act fast. Fast by acronym means face, your arm, your speech, and the time you reach to do intervention. In the clinic, they will give you antifibrillary like Activest, then followed by aspirin within 1 hour. Then it can restore your circulation, so that within that 1 hour, your neuron in the head or in the brain are not yet dead. Then you can survive.
Lastly, before he left the audience, he took some questions.
Presentation. So right now, dear friends, we are going to take questions or reactions. If you have any question, then you can indicate and go ahead. Okay, go ahead, please.
Yes, thank you very much, Takumba, for the presentation. Well, the presentation that you wonderful presentation that you presented. We've had a lot of issues or incident like this one back home being associated to witchcraft and things like that. Because of late, I've had some seniors back home who've suffered from a stroke and they end up losing their communication. And in most cases, some of those things are attributed to our noise witchcraft is witchcraft. So is there any way that no reason why some of the stroke would give somebody will be able to communicate while the other person doesn't? I mean, a total loss of communication.
I think my guess is, I will go back to the brain like I explained that, your brain is divided into different portions, into different segments. If you dissect the brain, you see that there's a different area that coordinates every part of the activity. That's why we always talk of acting fast, because remember, if you block the blood flow to the brain and you leave it for too long, the cell it continues to die and move on. It's not just that area, because the blood does not continue to reach there, so the cells are begin to die and begin to expand out. So sometimes, like here in the US or in Canada also, you see that when people have stroke, they always survive, because the medical emergency or the health system is more equipped where there's rapid intervention. With us, it takes more than 24 hours. By the time you reach there, that clot has already completely blocked that area, and those cells have died. I don't have the correct time data now in my head. How long does those cells take to die in the brain when they do not have oxygen? So the longer you stay, the chances of survival are very minimal. So that's why when you stay for too long, before, say for example, you leave some village in our area, before you reach to Mary Head of Africa, where there are no vehicles you are treating may take days. Sometimes this happens people do not even know. But before you reach there, that part of the brain is completely damaged. Then that person cannot respond. Then what be tied to if it was hemorrhage stroke? The blood filter into the intracranial nerves in the brain. There is nothing you can do at that point in time. It destroys that part of the brain definitely.
We encourage our viewers to stay connected to our channel for more on these community health discussions and other educative topics.
At this point in time, I want to say a very big thank you to our guest speaker, Mr. Ernest Kumba. Thank you as well to Dr. Fozal for stepping in as well to give us an insight into this very sensitive topic, as well as Dr. Kiara as well. I want to say a big thank you to all those who logged onto this platform to benefit from this very useful information. And you, dear viewers, we thank you as well for tuning in to be a part of this program. And we hope that this information that we have gathered here today is going to go a long way to help us to stay healthy. All we need to do now is to make good use of this information to keep ourselves healthy. And that is our goal here at Gaza Media, to keep our audience healthy. Thank you so much once again for being a part of this program. Please do not go away without subscribing, like, share, and leave us your comments. And as your host, I have been Gilead Atemken. Do have a wonderful day ahead.